and welcome to the Borno Health Update. I'm your host, Ibrahim Amarawa. On our program, we track the advancement in the healthcare under Governor Zulum's administration. In this episode, we focus on the transformative efforts spearheaded by Professor Baba Malamgara, Commissioner of Health and Human Services, who is driving innovation and resilience in our healthcare system. Contributory healthcare schemes are a vital component in achieving universal healthcare coverage. In line with this, the Borno State Contributory Healthcare Agency, BOSCHMA, has finalized all arrangements to launch the formal sector enrollment under the Contributory Healthcare Scheme. During the facilities assessment tour, the board chairperson of BOSCHMA, alongside the executive secretary, guided by the Commissioner of Health, Professor Baba Malamgana, on a tour of 5 facilities onboarded to the scheme. The tour highlighted the preparatory measures taken for the scheme's rollout and underscored its significance for strengthening the state's healthcare system. In a briefing with the journalists after the tour, the Commissioner of Health expressed strong satisfaction with the design and implementation of the contributory scheme.
And let me begin by appreciating His Excellency, the Executive Governor of Borno State, Professor Babagana Omarazulum, who deemed it fit to introduce the formal sector into the contributory agency program. I've gone around with the board members today. I'd like to recognize the chair and the rest of the board members and the executive secretary for working so hard and assiduously to see that this formal sector incorporation into BOSCHMA is fully done. They have, prior to coming here, visited other states, which include Yobe, Gombe, and Katsina states, where they've seen for themselves how these states have done with integration of the formal sector. What I have seen today is excellent. I like to appreciate them for the hard work and that they have made a lot of changes into the 5 hospitals we visited today, as well as the Borno State Drugs and Medical Consumables Agency. These changes included infrastructural changes, where adjustments have been made to facilities so that formal sector can be accommodated. Seating arrangements have been done, and in many of these hospitals, it is actually better than private hospitals outside. So we are very grateful His Excellency has brought the formal sector on board, and we're very grateful to the BOSCHMA for ensuring that this is possible. I'm sure you're well aware that the contributory agency is very crucial in terms of care and management, because a lot of Nigerians spend a lot of money out of pocket expenses in order to get health whilst they are sick or not well. And this, in some figures, is up to 70% will do so. But with this, we can assure you the formal sector in Borno State will now have a sigh of relief. They've all been captured on computers with their families, and they can now come to these facilities and be seen to with professionals on ground and with all the equipments necessary to initially assess them. This includes laboratory services. We have seen how in these individual hospitals, their pharmacy departments are functioning very well. They have been upgraded, and you have seen even branding of the drugs that is being supplied by BOSCHMA. This is really, we have taken it even to a greater height. We have also visited the Drugs and Medical Consumables Agency. I want to appreciate the executive secretary and his staff and the board members there, where they have been able to cater for this formal sector. We have seen the huge quantum of drugs, qualitative drugs, that have been made available for the formal sector. And I want to thank His Excellency, the BOSCHMA board and the staff, as well as BOSCHMA, which is Drugs and Medical Consumables Agency, because in each of these hospitals, I have seen the quantum of drugs that are available ready for usage by any of the formal sector coming in. So this means that we will continue to save lives in Borno State. We will continue to provide quality healthcare in Borno State. And the aim of His Excellency, the Executive Governor, is to ensure that universal healthcare coverage is brought nearer to the people.
The commissioner also noted that these infrastructure developments are among the key reforms introduced by BOSCHMA, which has previously studied similar models in other states across the country. He assured the public that these efforts will guarantee access to quality healthcare services. He emphasized Governor Zulum's commitment to any initiative that transforms and improves healthcare delivery in Borno, adding that these singular efforts will complement government readiness towards eradicating the maternal mortality that has been bedeviling the state.
Borno State has one of the highest maternal mortality and newborn mortality in Nigeria. And Nigeria has the highest in the world, the highest maternal mortality and newborn mortality in the world. Nigeria contributes 30%. Borno State is number 3 in Nigeria. After Kano and Katsina states, Borno is next in terms of high levels of maternal mortality and newborn mortality. In this respect, His Excellency, you may recall, has previously started this campaign of free maternal drugs, and is ongoing. And this is to mitigate the maternal mortality. And not only that, Borno happens to be one of the very first states in Nigeria to introduce cesarean section. Last year, we've done over 2,000 cesarean sections, and which is free. I can assure you, this hospital we're standing in, they have already commenced free cesarean section, and we're working together to see how to improve that further. Now, this formal sector introduction, you can see the setup, the clinic setup is such that antenatal clinics can be conducted here, and newborns also will have clinics where they will be seen here, as well as if they require cesarean section, we are all set to go. So therefore, we are not standing on our oars in terms of maternal mortality reduction. And this, we also have here in Maiduguri, we have got the emergency ambulance system, which is for pregnant women and sick newborns, where they can call an ambulance from their homes, and the ambulance can come and pick the lady in labor and deliver to our respective healthcare institutions. So therefore, with all this, we have already started seeing with the Safer Birth Bundle of Care how maternal mortality has started reducing at least in the Maiduguri metropolis, where it's the highest in the state, and also newborn mortality has reduced within the period under review. And therefore, I'm very happy that this is another, a feather in the cap, if you want to look at it that way, that, this introduction of the formal sector will actually strengthen our healthcare system. And we're going to bring in even further trainings to our staff, so that the respect and dignity for all patients will be there at all times, and particularly our women who are pregnant be treated as precious when they come to our hospitals.
That was Professor Baba Malamgala, the Commissioner of Health. In their respective remarks, the board chairperson and the executive secretary emphasized that BOSCHMA has developed an excellent plan to begin enrolling the formal sector into the contributory healthcare scheme, as all necessary support has been provided to the facilities. They added that with significant support from Governor Zulum and the Commissioner of Health, BOSCHMA will not fail in delivering quality healthcare services to civil servants of Borno State.
Let me seize this opportunity and thank His Excellency Professor Babagana Omara Zulum, who deemed it fit to appoint us on the issue of this contributory health management system, and then for also introducing the formal sector scheme. You see, what we have been trying to do is that we want this agency to function, and that is the mandate of His Excellency, and the agency is going to function. And now we have decided to support the various facilities. We supported them with a lot of things: renovations, providing them with solar, providing them with Starlink internet, and so many things, including CCTV to curtail pilferage. And we have been following them even through the HMB. We have been having serious discussions on the manpower supply also, together with the drug agency management.
Let me thank Almighty Allah subhanahu wa ta'ala for giving us this opportunity to achieve this milestone. What BOSCHMA believes in is actually digitalization, and you can see it during our visits. A whole lot of things has been actually transformed. The electronic health record has been established by the agency, and then we have now transmitted it down to the facility level. We've also supported those facilities with hardwares as well, not only softwares. You can see all the computers are available, the CCTV cameras, and all those things are actually interconnected in such a way that you can even monitor the activities while you are even at home. So that is the beauty of it. As for the enrollment processes, we also did the same. Earlier on, we started with direct biometric capture, and eventually we now developed a link whereby every person can be able to enroll himself by going through the link, and he can also enroll his dependents, his wife or her husband, or children, that is the four children below the age of 18. And the electronic health record has helped us a lot, where in the past we've been battling with missing records. We've been battling with missing folders of patients or enrollees at the hospital level, and research cannot also be conducted with this presence of these missing records and what have you. And it is actually through the data that we can find out like how much people have attended, have accessed healthcare. And if there are any issues also, we also have our own dedicated line for customer care. And they can also call those lines to actually tell us if they have any grievances or any suggestion that might actually help us.
The success of the contributory healthcare scheme relies not only on infrastructure and technology, but also on the reliable supply of essential drugs. It is for this reason that the Commissioner of Health facilitated a Memorandum of Understanding MOU between the Contributory Healthcare Agency and the Drug and Medical Consumables Management Agency. This agreement is designed to eliminate the issue of drugs out of stock entirely. At the ceremony, the Commissioner underscored Governor Zulum's transformative milestones in the healthcare, stating that the establishment of these two vital agencies stands as an unparalleled achievement.
indeed my singular honor and privilege to be here this afternoon to witness such a milestone in the trajectory of our healthcare in Borno State. Such a milestone cannot be attained without the ambience, the environment, and the support of His Excellency, the Executive Governor of Borno State, Professor Babagana Umar Zulum, CON, MNI, FNSE. He has given the healthcare support that has never been seen before. The establishment of Borno State Drugs and Medical Consumables Agency was indeed one of them, as well as the creation of the Contributory Healthcare Agency. Borno State currently is basking in sun with over 50 general hospitals in the state. We have so many specialist centers in the state, including the eye hospitals in Monguno, Dental Hospital Monguno, Eye Hospital Biu, Dental Hospital Biu, and of course the Orthopedics Hospital here in Maiduguri under construction. Recently, we have witnessed the revitalization of so many primary health cares, 135 of them, and they are fully revitalized with drugs. And His Excellency was in Howell, and he saw for himself and gave praises to the BOSCHMA for seeing the number of amount of quantum of drugs in Howell when he was visiting. His Excellency's aim has always been that he wants the citizenry of Borno to be healthy. Let me also appreciate the Labour Congress. Whilst this process of bringing informal sector was going on, including many meetings were held, including with the Secretary of State Government, the Labour Congress saw and accepted the importance that the formal sector would play if they join the contributory agency. So we want to appreciate their understanding and support throughout this journey, which has now reached the climax. So I can assure you, not only here, but beyond, all the civil servants and all the people, good people of Borno State, that the drugs we are getting are from sure source. Let me also reiterate the fact that by law, all our health institutions, be it primary or secondary or tertiary, must acquire their drugs through the Drugs and Medical Consumables Agency. This is according to the law established in the agency. So therefore, let us take note of this, and what we have witnessed this afternoon is a testimony that when we work together, we can go to greater heights. This signing ceremony today is very critical, it's very important, and let me assure all the civil servants in the state that we have made adequate preparations in all our hospitals and very soon also in primary healthcare centers to be able to provide the needful in our facilities. I want to assure you that the BOSCHMA has capitalized the Drugs and Medical Supply Agency to make sure the drugs are available. They've also supported the hospitals in terms of critical equipment and in terms of introducing electronic medical records in some of the facilities. We have already got some already, but this is another, feather on the cap so that our healthcare facilities will eventually be fully digitized.
The executive secretaries of BOSCHMA and BODMA spoke about the significance of the MOU towards providing better healthcare services to the formal sector enrollees.
I also want to seize this opportunity to extend my deep and very sincere appreciation to the Honorable Commissioner of Health for the guidance and support in our achieving our mandate. The Permanent Secretary has also been on the steering to also guide us to do the right thing. The board chair and her team, we've had a lot of collaborations and meetings with them prior to having the formal sector on board. We have even gone to various other states to see how they do their activities. This just to guide us so that we have a very good start. My brother here, the Executive Secretary of Borno State Contributory Healthcare Management Agency, Dr. Saleh Abukazar, who has been the actual driving force in the whole of this affair. I want to, on behalf of our agency, appreciate you so much for always looking forward to us as a sister agency. In line with the mandate or in line with the law that established our agency, we are supposed to provide qualitative drugs and medical consumables, every medical consumable, including laboratory consumables, radiology consumables to the state government. We are supposed to quantify, procure, warehouse, and distribute to every sister agency. This is the mandate of what the law of this agency is being established for. The Honorable Commissioner of Health has mandated us to make sure we move on the guiding principles of our agency. So in line with this, for the formal sector, we have sat down plainly with the team. We have sat down and see how we can kickstart this program very well. And the first thing we did was to sit down and look at what are the requirements for the Borno State indigenous, what are the consumption patterns. We looked at demand aggregation, looked at the facility to see what they need, both drugs and consumables. I and my team prepared a list that is required, submitted to the Contributory Healthcare Manager. We sat down with the board and looked at the team list and see how we can go about this. And this is in line with the essential drug list of the Borno State Contributory.
The governing board of Borno State Contributory Healthcare Management Agency has approved that we should actually have this relationship and document it. And this is actually to ensure transparency and accountability on utilization of resources, including the funds that BOSCHMA is releasing to the Drug Management Agency, as well as the drugs that is being procured, as well as hospital consumables from the Drug Management Agency. And that is why we are here this afternoon after the oversight visit led by the Honorable Commissioner this morning. So with this, I will appreciate all the stakeholders that are supporting the Borno State Contributory Management Agency.
Thank you for joining us. Stay tuned for next week's update, where we'll explore more innovations in the healthcare sector. This is Ibrahim Amarawa, reminding you health is wealth. Our Borno is on the rise.